by using a good quality of a bone graft. So what is the use of CBCT? It helps in identification of the diseases. It determines the bone quality, bone quantity, the position where we can place the. Or it's going straight, or we are not near to any vital structure also. So in this way, CBCT helps in the orientation of the implant. Now, second option which CBCT software providing us is we can also plan the process. It's because the forces, the occlusive forces should pass on the center of the ridge. Because if it will be buccally or lingually, somewhat lingually, it will cause first of all the resorption of bone. Secondly, our prosthesis will not be forces will go on our abutment, and then abutment will try to bend, and this is the major cause for the failure of the implant or the breakage of the screw or neck of the implant. The ocular forces are the main culprit for breakage of the neck of the implant. So as we have discussed in previous slide, we have seen D1 type of bone according to Housefield values. So D1 is a dense cortical bone, D2 is a thick, dense to posterior cortical bone on crust, and coast trabecular bone inside. Then D3 is the thin porous cortical bone on crust and fine trabecular bone within. While D4 is only fine trabecular bone and D5 is immature or non-mineralized bone. So this gives a type of a bone. Which bone is good? The best bone for implant placement is D2 bone. D1 is a worst bone for placing the implant which we are using. D4 bone can be converted to D3 or D2. But D1 bone can't be converted to D2 or D3 or D4. The second main reason is in D2 bone, we have thick, dense cortic bone or outside covering of the bone, but center is trabecular bone, and it gives a good blood supply in the center, which is must for the healing of an implant. And we have thick bone outside, which keeps implant in its place only. But in D1, we have dense cortical bone. The blood supply is very low. We will get or we might get a very good torque, but implant failure are more in that case.
Some might be doing bicortical implants or single stem implant. For them, D1 bone is good. Now, after CBCT, second will surgical guide. So surgical guide may be fully guided or partially guided. Fully guided means when we make a guide or a lab makes a guide, okay, just we have to drill along that the holes they have given. The holes which are made in the guide, okay, they are stimulating the implant size only. Accurate surgical guide, because for making a surgical guide, the lab person or a center should know how to read the CBCT. Now third one, which is the most advances, is implant navigation system. We are using apex locator while doing RCT. Okay. It shows green, and when it shows red, that we have read the apex and start beeping. If we touch the apex or moves out of the apex. In same way, we have got an implant navigation system. Okay. Our CBCT is loaded in the software. We get the whole of the CBCT software to on the screen. The handpiece is connected to the software also. So when we are going to place implant or when we are drilling, same time we can see on the screen that we are where we are going in bone or away from the bone. As we are going inside, there will be a green sign on the screen also. If we are going to approach near any nerve or we are changing any part, then there will be an arrow mark or it will turn into red that we are affecting any vital organs. And there is red appearing, just we have to stop there. So means it's a type of tactile sensation which is converted into detalization. Now, seventh is the knowledge of the good surgical and suturing techniques. So, whether placing dental implants or performing bone grafts, these procedures must be done well, and it is vital that they should be covered by the soft tissue. There are specific situations in which dental implants do not need to be covered by soft tissue, but bone grafts need to be covered by soft tissue. So, knowledge of the good suturing techniques to hold the gum tissue in place so that the bone graft or the implants are protected from the oral environment for long-term success. If the gum and
Recording in progress.
if we do not have a sufficient mucosa or gingiva to suture, we have to just give the relieving incision so that we can pull closer the two ends of the flap. and then suture it. Uh, and one more thing, I am using for last 2 years and send the patient. The healing will be very, very good in compared to any other thing. And in 90% of cases, you will get a good healing as well as no peri-implantitis. So the conclusion is the commonly accepted criteria for the assessment of implant success were proposed to identify clinical evidence of successful osseointegrations and survival of implants. So over the past 3 decades, implant success has been assessed by survival rates, continuous process stability, radiographic bone loss, and absence of infection in the peri-implant soft tissues. So this was a small lecture about the 7 criteria. In further webinar, we are going to learn or discuss about each and every criteria in details. For example, for the first key was about the medications. So in what medications are done given by the doctor, what medication we should give to patient in which condition, that all will be discussed in details. One webinar will be on just only on CBCT, how to read the CBCT, how to know the quality and quantity of bone, how to place the implants and crown virtually in the CBCT only, how to know from which part of the oral cavity or jaw we have to take the bone and use as a graft on the other side. So different webinar in which we are going to discuss all the different parts in details. This was just an introduction for to keep to such implants. So we are going to discuss in details in the further webinar series. Thank you. If you have any queries, you may ask me.
Good evening, sir. This is
For
Dr. Abhay Kulkarni.
wonderful webinar. Please go ahead with the query. Yes, sir. Sorry, sir. Yes.
Yeah, it was a very nice lecture. I congratulate you for that. Uh, my question is, you have talked about the gingival growth, right? I mean, the gingival tissue. If the gingival tissues are more in thick, won't they cause the gingival overgrowth after the implant placement in the particular area? And that can be a cause for causing peri-implantitis and further probably failure of implant. So is it there that some thickness of gingiva should be there?
No, if it's a flabby ridge or flabby tissues, then we have to surgically correct that first.
Okay.
Yeah, I am talking about the healthy gingiva. Healthy gingiva means we can go for 4 mm maximum. That will be
Okay.
ideal one. But
Okay.
if we are going for full mouth rehab patients,
Uh,
you might be seeing the patient is not wearing denture or has just wore denture for many days, and there is a soft tissue growth. And when
uh,
we go for CBCT or we palpate that area, we can know that there is the movable tissue. This means that the soft tissue growth is more and very the bone is very deep inside. It might be almost around 10 mm from the bone. So first we have to correct that.
okay.
Then we can go for implants.
Okay. 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 Another question is, you have told about the medications what the implant patients are taking. Are these the self medications you are talking about, or those were prescribed for that?
These are prescribed medicines because
Oh,
medication Just a second. Yeah. Because many patients don't know about the medication, they then don't say what medicine they are taking. So we
Uh-huh.
have to make them to say that they are taking some medicines or not. Because if we are not knowing many medicines, if patient is on high BP or blood thinners, or might be he or she may be taking the thyroid medicine, we have to
Uh,
know that medicine or what amount of dose they are taking, and we have to consult their consultant about that medicine also, because some medicine interact what we are giving.
okay, okay,
And for
okay.
actual
Okay.
contradiction, there is bisphosphonates only. And we are
Okay,
not
okay.
talking about the autoimmune disorders or blood
Uh-huh.
disorders.
Okay, okay, okay. Ozone oil application also you told. It's you have done after placing the all the implant and placing the sutures, right?
Right, right. I have used ozone oil given by
Okay.
doctor,
Yeah,
as
yeah,
well
I
as I
know.
am
Even I
using
have
blue M
used it.
gel.
Okay.
Yeah, these give excellent results. The ozone oil gives very excellent result in extraction cases because it
Uh-huh.
increases the healing.
Uh,
While I have
you
also
have
used the blue M gel, ozone gel also. After
you
placing
haven't
suture,
tried any time intraoperatively. Intraoperatively.
after placing implant,
Uh-huh.
then when I give suture, after giving suture, I just apply a layer of gel over the suture,
Okay.
cover it by the gel, put some drop of the
Intraoperatively, like
ozone.
before placing the implant itself and all those things.
No, after placing the implant, after placing the suture,
Okay, okay. Then only you have tried it. Okay,
yeah, before placing the implant, we can't give.
okay, okay.
And you have asked this question, so I would suggest that when you are placing the cover screw or ginger former,
Uh-huh.
just use hexigel on the threads of that cover screw or ginger former,
Okay, okay.
and then tighten it over the implants.
Uh-huh.
Uh, This will prevent from any periodontal problem or periimplantitis.
Okay.
Any more questions?
Sir, good evening, sir.
Good evening.
Sir, I have one question.
Yes.
Sir, how do bone graft changes the quality of the bone?
For example, we have the D3 type of bone,
Yes, sir.
okay, or a D4 type of a bone,
Yes, sir.
in which the cortical plate is very thin.
Yes, sir.
The center part is almost hollow.
Yes, sir.
Okay. So, for example, you have seen the construction site
Yes, sir.
for building any building.
Yes,
First
sir.
of all, what they do, put the pillar.
Yes, sir.
Okay. Just think that pillars are like the side walls or side bones.
Okay, sir.
Center part is hollow.
Yes, sir.
So to provide strength to that part,
Hmm.
the next step what they do,
They fill
they
the
just
cement
put
and concrete
cement,
all.
building material and stones
Yes, sir.
in the center part.
Yes, sir.
Okay. After some time, what will happen? It will
Listen.
become rock solid.
Yes, sir.
So same applies for our bone also. The side coverage or the cortical bones are thin. They act as a socket. In
Hmm.
center part, we put the bone graft,
Hmm.
which on healing becomes hard and can adapt to the neighboring bone.
Okay.
Okay. In soft bone, if we are giving the torque of 10 to 20 newtons, but
Yes.
after putting the bone graft, we will get the torque of more than 35 newtons.
Okay.
In this way, we can convert the bone from D4 to D3 to D2.
Okay. So, sir, which technique do we use? Like we have to do osteotomy first, then we have to place bone graft, then we have to put the implant.
No, if there is there is a good amount of bone,
Mhm.
on a one wall.
Yes, sir.
Then we can place, we can do ostomy,
Yes, sir.
place implant,
Hmm.
and we can place bone graft in the jumping area.
Okay, sir.
Jumping area means the space between the implant and the bone,
Implant in the bone. Yes, sir.
and thus we can suture it.
Okay, sir. Thank you, sir.
Okay. Any other questions?
Yeah, any more questions? Anyone has any questions or queries?
Sir, after how many days can we place the implant in that grafted area?
For mandibular, we have to wait for 1 to 1.5. For maxillary, more than 2 months, because maxillary bone is porous.
Okay, sir.
There is a question in chat section, sir, from Dr. Manish. Up to
Just
how much sugar levels we can place implant? What should be the blood sugar of the patient minimum when we can do the implants? The level of the
okay. Blood sugar level.
blood sugar level. What should be the blood sugar level so that we can safer blood so that we can place
Yeah, yeah. Dr. Manisha asked up to how much blood test sugar levels we can place implant.
yes, yes.
So we are not going for blood sugar level. What we are given 120, 200, 180. Okay. First of all, go for HB1AC. The value that value is more important. Okay. Patient might be taking insulin also. It might reduce the blood sugar level. Okay. But we have to see for HB1AC of that patient. For example, I have got one patient in my clinic. In last visit, he had a blood sugar level 200 only. But on testing of HbA1c, it was about 12.8. I consulted the diabetic doctor. He told me that it should be around, for any surgical procedure, it should come below 10. Then only we can treat. It should be below 10 and around 250. Then we can proceed for surgery.
Okay, the combination.
Yeah,
Combination
it's
of
a combination.
blood
We
sugar.
just can't rely only on sugar level.
Below 10 should be HB1AC.
Yeah, below 10.
Okay. That to under end.
Sir, how does double-edged implant help in osseointegration? And also, why is it only double-edged? Why we can't do triple or 4 times? I mean, why only double-edged we go for?
Can you repeat the question?
Sir, we see कि implants are majorly double-edged for better osseointegration. So my question is, why is it double-edged only? Why we can't do it like for triple or more times?
You are
Why
saying
not for single time?
double edged or edged?
Double
Double-edged.
edged.
Yes, sir.
H or edged? E D G
E
E
T
D.
EETCHED. SLA, sir. SLA. Sand blasted and
Okay,
double-edged.
okay.
Yeah.
So we are going into that part now, the surface metallurgy of the implants.
Yeah. Yes, sir.
I think we can discuss in our next webinar. But for your information, we can go for surface treatment implants because they are more also integrated. They have get the chance of most integration. because it causes induction procedure started. Induction is what? It induces the bone, human bone,
Okay.
to produce the osteoblastic cells. By
Yes.
this, there is more osteoblastic activity. The cells come in contact with that implant site, and the bone healing start fast. Okay, so
Okay.
for example, that DO company is producing one type of implant, that is UV implants. In Novel Biocare, we have one higher implant, conical implant also. In that case, there is much fast healing compared to other implants. And each and every company gives our sandblasting implant also. The first step is on sandblasting only. And
Yes.
almost all company are substituted now.
Okay. Thank you, sir.
Yeah, I think all the queries are done. We will be having more webinars from Dr. Hemant in future. We will announce it. You can save my number for there will be webcast messages to you, broadcast messages to you. You can see the announcement of the webinars in future. If you want to attend the previous webinars, which are on YouTube, those also links can be sent to you. You can attend those also for the new members. Old members have already attended it. So let's see, let's meet in the next webinar on 26th Jan, that is by Dr. Khanna, Deepika Khanna for prosthodontics. So thank you, Dr. Hemant, for a wonderful session, and all the queries are answered properly. Everyone is knowing now about the topic. For more learning and more sessions, they will attend more webinars in future from you. So thank you so much for coming to ADC today and presenting it.
Thank you, Dr. Sudhir, for inviting me. And if anyone have any query, you can WhatsApp me or mail me.
Yeah, you can ask me his details. I will send. Dental Creators Group is also there. You can join that group also. They have academy also, basic and advanced. Dental Creators Basic and Advanced Academy is the name. You can join the academy, as well as you can have the personal of Dr. Hemant, and you can directly contact him for courses and all. The many courses are there in his academy at Indore. Okay, Hemant. Thank you again. Thank you everyone for attending. Good night. See you next Sunday for the next webinar. Number 157. Thank you.